everybody. Welcome to Open Office Hours. So we'll go ahead and get started. Thanks for doing this.
Thank you for the opportunity. I really appreciate it. You're doing a lot to spread the word for women and general health.
So I'm just so pleased. You are Sarah Borda, and you're a board certified licensed massage therapist as well as an educator. And then you're also trained in myofascial release by the John Barnes PT method. So we'll love to hear more about exactly what that means. And you have a practice up in New Jersey called Body Heart Therapy in Chester, New Jersey. And it's you're also on Instagram, which I still haven't figured out, but I'll join the century eventually. Um,
Okay.
Myofascial Heal underscore Sarah with an H, SARAH is your Instagram handle. So maybe you can just kick things off and kind of let us know how you got into this line of work.
Okay. I'm about 25 years ago, I went through a divorce and I wasn't doing any of this then. I was a stay-at-home mom with three little boys. And so I went through this divorce and I became like very embodied during the process because it was so painful. And I had to go to all these different, I was introduced to different healers at that point in time, touch therapy. So I went from one person to the other. It was a reflexologist, an aromatherapist, a Thai massage, like just everything, because I couldn't live in my skin. I was so uncomfortable with the prospect, even though I had asked for the divorce. I was so uncomfortable. I was so uncomfortable just being present. I couldn't be present. I was so anxious and worried. And I just I would take like 3 salt baths a day just to get through the day. It was really, really hard. But over time, what occurred to me during the process was that and I was talking to a psychologist, and that's all great, everything helps. But what I realized was the touch therapy was what was sustaining me. The
Mm,
touch therapy was what was nurturing me. The touch therapy was nourishing my entire sort of ecosystem. And I was being heard and held and witnessed and not judged.
right.
So that's how I got into it. I decided once I got through my divorce and everything got sort of settled into the new house and all that, I said I need to help people like this that are going through transitions of their life. I think specifically, I came into it to help with the untetheredness of transition in our lives and the passages that, like, I think especially women go through,
Mhm.
as mothers and women. And so that's how I got into it. And then I went to massage school and I got my license. And then, so I kind of came in from the emotional door versus really, like, I was like anatomy and physiology, whatever. I know the emotions live in the body too. So, like, let
Right.
hold people during this time, right? And I'm also a very sensitive, touchy person. So I'm using my strengths in my profession. And so I started, working with people, and then I got introduced to the John Barnes method of myofascial release. And John started talking about the fight, flight, freeze in the system, the freeze that gets locked in the tissue, and how there's tissue memory and trauma settles down into the system. And then we're still living like we're always in the trauma every single
Mhm.
day. And that the John Barnes approach actually softens and melts the tissue through very gentle hands-on techniques, and lengthens and hydrates and starts to bring this sort of, instead of the freeze and the brace, starts to bring this buoyancy back into the system and resilience. And just to make the distinction between myofascial release and John Barnes, the John Barnes method is gentle and compassionate, and there's no force. So anyone that's going to somebody that says they're doing the John Barnes approach, That's how it's supposed to look. Like nobody's supposed to come out of these sessions bruised.
Mm-hmm. Right.
There's an old form of myofascial where people would whip out their elbows and just rail on you, and that's not healing. I mean, sometimes you need a little deeper work, but we're not here to. The thing I've learned from John is that we respect the organism.
Hmm.
We're organisms moving through space and time, and we hold the body with great respect. That our bodies are so intelligent that we're waiting for the guidance from our bodies. So it's taught me a lot about not waiting for the perfect client to come in, right? And meeting people where they are, and
Yeah.
learning how to be with people in their craziness and their beauty, the beauty of their life, and all of these things. So and I love it every day. It's
Great. So, just in case people don't know, right, maybe we can clarify fascia. So, myo means muscle. People usually know what that is. I always think about fascia if you are a meat eater and you eat chicken, kind of that sheath of white, tough material around a body of muscle. But maybe you can give people a better explanation just so they know when you say myofascial what you mean.
Yeah, so myo, like as you said, myo means muscle, fascia means connective tissue. And
Mhm.
yes, that's a version. What you see with the chicken is a version of the fascia. But
Mhm.
I think the general consensus out in the world is that there's this like layer of fascia around us. That's the fascia. But the fascia is basically the environment of your body, and this, it's a spun web of tissue that is infusing every structure, wrapping every structure, and then wrapping those structures again, and then wrapping those structures. So there are a lot of sort of spirals in the body, and you cannot see. And we what we can identify as therapists with our hands are fascial, what we call restrictions, and
Mhm.
that isn't, those are areas where we're not moving, like the tissue's not animated, there's an inhibition of movement, and so that's the glue, like the ground substance gets glued down, and so this is the glue, and we melt the glue. But a restriction cannot, the thing that's trippy about it is that you cannot see a fascial restriction on an MRI and X-ray, any traditional tests.
Right, right, right.
And,
And I think, go ahead.
and I was going to say, and that sets up a whole nother complex for those of us that go to the doctor and we have these complaints and they do these tests and nobody can see anything, and they're like, it's all in your head. So then the person goes back and that starts a whole nother tumbleweed of issues.
Mhm.
When really it's about the testing. You have to have an electron microscope to see a fascial restriction, but we can feel it.
Right. And then one of the things you said that I really loved, kind of thinking about, maybe my kind of chicken description was really simplistic, that this fascial connection, we see this a lot in women's medicine, right? Women who clench their jaw, that don't breathe diaphragmatically, are often holding their pelvic floor really tightly. So, if from a very Western approach, it would be hard for someone to make the connection. Why does clenching my jaw and grinding my teeth have anything to do with my sexual pain? But if you're thinking about myofascial connections, they're connected. And so one goes to the other. So maybe you could kind of talk about, if we're kind of bringing women's medicine into this, maybe put together some of those connections that aren't really obvious for people that aren't trained like you're trained.
Right. Well, it's funny that you brought up TMJ or jaw, because that we usually go right to the pelvis when somebody has TMJ issues, because the hips mimic the jaw, and
Mhm.
we are constantly balancing the torque in the pelvis. So if your pelvis is torqued, then so is your nervous system,
Mhm.
travels all the way up and all the way down. And so therefore it's possible that your organs, your fallopian tubes, or this goes for fertility as well, any kind of female, well, it's the same for a man, just, it's, if they have a torqued pelvis, it's going to translate up their body, but it's going to twist the organs, so then the organs become a little suffocated in there and they can't, the organs, I mean, you know better than I do, our whole body is meant to be expanding and contracting all the time. And so we can touch your toe and you could feel it in your tongue with
Mhm.
a fascial work. It depends on where your fascial strain is in your system. And these things show up from, repetitive motion, trauma, accidents, surgeries, and emotional holding patterns. I'm scared. I'm scared.
Right.
It's an emotional holding pattern. I suck in my gut. I clench my jaw because I'm not going to say that because she always gets upset with me when I say that. So then that becomes an entire body brace in
Mhm.
some way. And then it shows up as a symptom that we start treating in the typical world as a symptom instead of
Right.
like, in a perfect world from our perspective, doctors would send people to us to rule out fascial restrictions
Mhm.
before you diagnose someone.
Right. Right.
So, yeah, everything is wrapped all the way to an intracellular level. It's hard to this work. I find it's difficult to because it's so far out of what we've been taught. But I think if you think of the skeleton and the way we've been taught about the skeleton standing there in all the pictures we learned about, and even on Halloween. But the skeleton can't stand by itself.
Mhm.
So in our minds, I think maybe we think the skeleton is in charge. It's sort of a masculine kind of thought to me. And then the connective tissue, but see, the thing is, the connective tissue is pulling on the skeleton.
Right.
So in a chiropractic place, they might think that the bones are controlling, but the
Mhm.
soft tissue is, if I have a C-section scar and I'm 50 and I had this surgery when I was 30, over time, this tissue is going to start to tighten down. And then
Right.
my upper body is going to go, I got to get my eyes level at the horizon. Oh my God, I don't want to fall over. And so then we start to tighten down up here, and there's a huge pull here, and then there's a pull here.
Right.
So the scar tissue, and that's one of the things I really wanted to highlight. Scar tissue for men or women or babies, anyone, is really important to have released by a John Barnes fascial therapist because we can feel the scar as it relates to other places in the body as well. And there's so much freedom that comes with that because not only are we stretching the tissue, this is a different kind of stretch too. It's not like a muscle stretch where we're like pushing to end range. The fascia is very finessed. And so, you have to go slow to feel the fascial wall, right? And so I don't know where I was going with that. Where was I? I was on the C-section and the scar
Right.
tissue. So if we release the scars, then the other parts of the body get to go, oh, whoa, right? We just took a fanny pack off off this body that was carrying around a cinder block. And
Right.
and this leads into how gravity is always affecting us, and we laugh about that as we age. Oh, gravity, da da da. But the truth of the matter is that we are heavily influenced by the electromagnetic field and the gravity. And if our body is not aligned and harmonized with this powerful force that we can't see, but we see the results of and we experience it, then we are always working against gravity. So I don't know about you, but like I want to work with that force, right?
Right. I just wanted to circle back to one thing you said about fibrosis and scarring and how untreated scarring can kind of then manifest in other symptoms. When we're putting that through the lens of menopause, and we know women have a lot, there's something called the musculoskeletal syndrome of menopause when estrogen levels are falling and we repair muscle less well. A lot of women will also present with frozen shoulder. They may present with like hip bursitis. And so the hormonal piece may be one thing that needs to be addressed, but also working with someone like you that maybe you didn't make the connection between low estrogen and this more fibrotic, poor healing muscle state. Maybe you've already set up to halfway, maybe when we think about frozen shoulders, she can't blow dry her hair anymore. She can't reach her hand up over her head. Maybe you're here, right? And maybe you need to go ahead and get some myofascial work in conjunction with getting the hormones. And I think that's where sometimes people are like, just take the hormones. And yeah, the hormones are great, but then we need people like you too to kind of work on the big biology piece of it.
Yeah, we have to address the structure because the structure is going to affect the chemistry.
And function.
Yeah, and so I agree with you because I don't know chemistry, right? Like you're the chemist. I don't know chemistry, but it would be ideal to be working with someone that is doing what you're doing in conjunction so that this person, this patient is getting care from lots of different angles. It's never one thing, but
Right.
for us, it's like let's get the burden out of the system so that these cells and organs and systems can function the way that they know how to function without a lot of help, you know,
Mm-hmm.
and aging, I'm seeing a lot of women that are aging now. And I see, from infants to from newborns to 90-year-olds, like
Oh
it doesn't
wow.
matter. Yeah. The baby thing is really great. That's a whole nother chit chat. But um, so what was I saying? I always do this. I get excited, I like lose my train of thought.
So we were just talking about kind of looking at small biology versus big biology, that we want to address both. And then you kind of went into, hey, but this isn't just a menopausal thing. Like you see people of all ages, which is fantastic, right? Because you may have, this happens a lot in my practice where someone says, oh, but my daughter has X, right? So one thing I just wanted to go back to, that, we're talking about that C-section scar. So I think that's something that a lot of people have.
Yeah.
Um, in an ideal world, would you kind of let someone get to their 6-week checkup? They've probably, they're safe to, get in the swimming pool and do those things before they were to see someone like you. Because, in the acute healing stage, someone's probably not going to tolerate a whole lot of manipulation. So
Well, yeah.
someone's listening to this and they're thinking, oh, my daughter just had a C-section. When should she seek care? What would you advise there?
There's a lot packed up in that because I don't work on scars for 3 months. I'm just
Yeah.
really cautious about it. But that's not to say that the person doesn't need care fascially. We don't have to have a reason to touch somebody fascially. Everybody has fascial restrictions.
Hmm.
For who you are, if you're in a body, you have restrictions, right? And they're affecting the quality of your life. It's just a fact. Simply because we haven't been introduced to for us when we were newborns. This just wasn't on the radar, right? Just not there. So I would wait until 3 months to actually work on the scar. But with that said, I can work off the body on the energy field as the scar starts to heal. But I would probably go to their head and start to stretch gently from there because lots of time, I mean, delivery is traumatic on a good day, right?
Yeah.
Not, but it's true. I've had 3 kids, like I know, like, but C-sections, I've worked with a lot of people with C-sections, and I mean, this is sort of near and dear to my heart because there's a lot of unspoken trauma around
Mhm.
C-sections
Mhm.
for some people, right?
Mhm.
And this is part of what gets addressed with this type of therapy is, people have the freedom to feel actually the emotions that maybe they couldn't feel at the time of the big event. And
Right.
anesthesia disconnects us from our senses and feeling. So, that still your body still had the experience, even though you're sort of cut off from it. And so we're trying to bring the life, sort of breathe the life back into the places that anesthesia sort of froze in a moment.
Well, and then in that moment, like, even if it's a scheduled C-section and it's not like an emergency and a crash, I mean, that's downright violent, right? Like I've been on the operating end of that. And, when like the kid's crumping, it's not delicate. It's not nice for anybody. It's like, let's go, let's get this kid out. So that's traumatic. And I think culturally, we also don't really hold space for the grieving of that wasn't the birth experience that I wanted, or I wasn't the first person to touch my baby, or whatever that the heart needed, wanted from that experience. Culturally, we're like, well, you got a healthy baby, you should be grateful, right? And now you're on to mothering. But there's not really a space to even discuss that medically, right? We're not trained to like have kind of, hey, we're going to check in with you. How are you doing? Do you want to talk through that birth experience, right? We're not, right? And there probably that would be really healing to be able to do. And so we are going to put it in our bodies. So I just, as someone who did that on the other end, I just wanted to kind of reaffirm what you're saying and kind of, I think it's such a common surgery, and that we would be great if we could create some space around helping people process this emotionally, process this physically, and hold space for a conversation that no one's really having.
Yeah, yes, I agree 100%. And in that same space, there are the abortions that never get talked about. There are the miscarriages that nobody wants to talk about. The mother wants to talk, but everybody else is like tiptoeing around, right? And there's not a space for this, but these are losses and they need to be acknowledged. And there's a lot packed up in those for a lot of different. My mother had a hysterectomy, and that like really put her over the edge because she was so connected to being a mom.
Mm-hmm. Yeah. Yeah. So so 3 months for working on the scar itself, but there are other, like you said, you just think about positioning, right? You have that cross section. Are we meticulously positioning this patient? No, we're not, right? So just working even back here could be really helpful.
Well,
Um,
there is the idea of position dependent memory. We have these experiences that are so hard, distressful, and scary for us that we disassociate from them. And no matter like whatever position our body was in that moment gets kind of locked down into the tissue. So
mhm,
there's a the idea of sometimes people might start to move a little bit on the table, or feel more comfortable in another position, and they might actually be intuitively putting themselves in a position where they can start to release the freeze or the trauma or the emotions out of their system.
mhm, mhm.
And, and
So go ahead.
there's just one more thing with the C-section. I had an experience with with a woman who her kids were like 30, and I picked up her legs and I pulled on her, and I said, "Oh, it feels like you're hooked up around your pelvis. Did you have a C-section?" She said, "Yeah." And I said, "Is it okay if I work on it?" So I started working on it, and she actually did kind of go back into a space where she was in the operating room, and she could see the nurse, and she started crying and actually tapping into those old feelings, and she said, "I just never got a chance to push." If you think about that, your body is gearing up for not even
Right,
push. Where the heck does that energy go when
right.
and so I said, "Well, let's deliver this baby." So she put her feet up, and I put my hands up, and I pushed again her, and she arched and she screamed and she delivered that metaphorically baby.
Oh, that's a beautiful story. I mean, I think that's a great example, though. Like another thing we're not like talking about, we're not holding space for. But you're right, the body is gearing up for this big event. It's sort of like trying to stop a sneeze, right? Like how do you
Or a
hold back a
good
sneeze?
orgasm. Who wants to do that?
Yeah, exactly, exactly. That's so helpful. So, kind of similar in that, but we work in functional medicine. We work a lot on the gut, and I just, sometimes you'll have a gut from the small biology perspective that you freaking can't fix, and then I'm often working towards people who do abdominal massage, working on, valves and sphincters and all those things from a big biology perspective. But maybe you could talk a little bit about kind of stuck guts, because a lot of people I think are stuck there, and then they may not all present with chronic constipation. They may have SIBO, they may have, what we call IBS, which doesn't really mean anything. So maybe you could talk a little bit about what you do in terms of intestinal health.
So it's an interesting area of the body because that is one of the areas that we go when we're scared. And it's very instinctual for us to go like this in our gut. And we have these psoas muscles that run along the back of the spine. And those muscles are basically the shelf for the colon. And so that means that they are like dance partners with each other. So if we're always gripped in fight or flight, if our adrenals are always kicked up, maybe we're stuck in an old surgery, or maybe we're stuck in an old love affair, or maybe we're whatever. If we're always pulled tight, then your colon's not going to be able to function the way it needs to be able to function. So what we do is we create space. I might work a little bit on your psoas muscle and balance your pelvis, take that torque out of your pelvis. If you're twisted like this, that could put a pretty good twist in your intestines. So we take you back to balance point, and your nervous system feels calmer because your feet are hitting the ground at equal levels.
Right.
So that's, I might, yeah, I would explore that. And bladder is in there too, right? Like our bladders, everybody says you got to put a diaper on when you get older. Well, maybe everybody just needs a little bit of pelvic floor work, whether it's internal or external.
Right.
Get their hips balanced. That could be a twist from your hips, twisting on your bladder.
Right. Right. So tell me a little bit about what programs you offer at your practice in New Jersey. And then maybe after that, you can talk about, for people who aren't local to New Jersey, how they can find someone who has training like you do.
My programs are, sometimes people start with 6 hours, sometimes they do 10. I also have a 1 day intensive, which is 4 hours in 1 day. And the Rosetta Stone is the 4 day intensive, which is 16 hours. So it's 1 day, 4 hours, the next day you're 8 hours down, the next day you're 12, and so on. That is a really amazing experience to get that much care so quickly, and for your awareness and your body mind to go through. People release a lot of baggage in something like that. So that's my program, and my website is bodyhearttherapy.com, and people can contact me from there too. But John Barnes, my teacher, he has a website, myofascialrelease.com, and there is a directory on that website that you could type in your state, and you can find a therapist in your state that is John Barnes trained.
Perfect. That's
So, yeah. And then one more reference that I think would be great for people is there's a YouTube called Strolling Under the Skin, and that will show you what the fascia looks like under an electron microscope. It's a beautiful crystalline matrix, and it's meant to give us all this energy and this flow, and be bouncy and protect us and transmit all this information and light and energy. And when we're bound up, we're not getting that.
This has been so fantastic. And I love that you shared that you have these intensives, because a lot of us as busy working professionals, coming once a week is really hard to accomplish. But if you could go and spend, take half a week of work off and have a chunk of time, I love that you offer that, and that people can really dive in deep, and then it's probably a lot more efficient.
I think that it brings you to such a rich relationship with yourself. You learn
Mhm.
the biggest thing that one of the biggest takeaways from it is that we learn to listen to the calls of the wild from the inside, and that is your intuition, and that is your thirst, and that is your hunger, and that is your sex drive, and that is your needs. And so just the idea of developing this deeper connection to yourself brings actually in the long run more safety to your life because you begin making decisions that are good for you.
Mhm. Mhm.
Yeah.
Thank you so much. This was amazing, and that's just a really heart-centered place to end. So, thank you. This was
I
fantastic.
really appreciate the opportunity. You're great. Thanks so much. Take care.
We'll share this with our community. Thank you.